anyone with anything to share, to ask, to whatever? You have 15 items, you said, Teresa. So
Yes, I want to hear them.
Well, I think the last time I listened to you, Abby, I think I attempted to listen into the last Zoom must have been at the start of COVID, and we're already 3 months, 4 months into it now. So my question back then, which I never asked, was relative to one of my daughters who had come home during COVID, and for some reason had developed a skin problem with a lot of spots, kind of boil type spots, very much dominant around her chin. And that area, which I know looking back on your notes actually suggested adrenals at the time.
If it's the chin,
Yeah.
if it's under the mouth, you know, so if it's around the mouth, I wouldn't say adrenal. If it's below the mouth,
Okay.
it's supposed to be conceivably adrenal. But the other thing, so you have a few things to look at. Let's have you finish describing the issue.
So diet-wise, probably is a bit mixed for her, even though she'd be very careful. She eats a lot of vegetarian, but I think probably maybe a higher sugar because maybe using more tinned products because of it. Does crave some sweet stuff like chocolate, and I think COVID made that worse. She did have the problem now before COVID. It isn't a COVID thing. Activity-wise would have very high activity levels, does a lot of running, cycling, so would be very fit. It just, over the last year and a half, where she wouldn't have had a history of it before, this certainly is something that has come in.
How old is she?
She's 27 this year.
Okay. Yeah, I'm just looking for possibilities of, you know, hormonal whatever.
Yes, I was wondering about hormonal as well, but it didn't seem to fit any particular change that had occurred for her with that. It didn't tie in with anything. She had changed from a contraceptive to the Marina coil, but the Marina coil was in, I think if I am right now, at least 6 to 8 months before this presented.
Okay.
No,
so there's a
Can I just ask a quick question before? Sorry, Avi. So would you say this is acne, or what? How would you define the spots?
I think it's acne. Except
okay, thank you.
As a very red, inflamed type of a spot, and she does get some just on the back of her shoulder. The shoulder blades is getting a few there, not as much. And I did do some acupuncture when she managed to get home, some TCM points, and we did a bit of work around liver and kidney and so on. And it actually did clear. It helped it definitely. But I probably would like to be looking at the Japanese thing more with her next time I get her home.
All right.
Which is I don't know when.
Okay. Well, you know, you have needles, you can travel.
We're not allowed to go out of the country or come into the country, so we don't know where we are here.
Oh, she's not in Ireland.
No, she's in Scotland. She's in the UK.
So, yes.
Difficult.
Much more difficult. Yes.
Yeah.
All right. So here are some ideas. If it's like you said, if it's below the mouth, but she also has it on the back, so therefore it doesn't quite become the adrenal thing doesn't quite resonate. But the things that will are so first of all, because you're describing it as boils. Okay, you use the word, I believe. Yeah, it's inflamed, it's red, it's puffy. So the point for boils is UB63, and preferably moxa, direct moxa. That's the boil point, so to speak. It's sort of a point for, like in TCM, you might define it as clearing toxic damp heat. So, because it's also for like what they call cockscrow diarrhea, meaning explosive diarrhea.
Okay.
So, and just look for the painful spot around UE63. It doesn't have to be like the exact location. The other thing is because it's around the mouth, but then you said around the shoulders also. So if it's in the mouth or around the mouth, rather than say adrenal, I think of it more as liver. Okay. what TCM would call stomach fire, we would call liver fire. And that's the liver 3, spleen 3 category. But you're also saying that she has it on her shoulders, in the back of her,
Yeah, she does get some odd outbreaks on her shoulders now. They have lessened a good bit, I think, since maybe she was home.
Okay.
4 months
All right.
ago.
So that now, so okay. Well, we'll get back to the shoulder thing because there could be a hormonal connection there. And the other thing is skin in general is a kidney 9 and large intestine 15. Okay, so that's originally a combination for skin that's being sort of, we use it for detox in general, but it's original. The origin of it is a skin combination.
Mm-hmm.
So those are the things I would try now. The thing is, without a diagnosis, in other words, without saying, oh, we understand, blah, 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 here is the etiology of this person, we can directly relate it to X, Y, and Z, therefore we should treat X, Y, and Z. So if we're just treating the so-called symptom, that's what I would, those are the things I would look at.
Mm-hmm.
Now, because she has some on the shoulder, and because, with women, acne-like stuff is very often, well, there are two things that it's related to. Number one is hormonal, and number two is liver. And partially the liver is because they give them antibiotics for clearing it, and then they give it, they take it for forever because like what woman doesn't, who doesn't want to get rid of their acne, so you keep taking this stuff, and then there's some weakness in the liver, which is why the liver 3 spleen 3 possibility would still be worthwhile. But if it's around small intestine 13, subgel 15 area, okay, in the shoulders, I would say look at the possibility that there is a hormonal factor, and then look at possibly UB62, UB66, UB66, and small intestine 3 is an option, possibly inner yin, like liver 9 level, but on the kidney channel. That's a hormonal area also. Then I had one more thought that came through and it disappeared. I guess I'm having COVID brain.
Okay.
Hold on a minute. It was to do with the shoulder. If, on the other hand, on the shoulder, it's more around, the whole shoulder blade, not just the top. If it's at the top, above the scapular spine, I would say that's likely possibly hormonally related. If it's the whole shoulder blade, I would say there's a possibility of it being digestive. And to look at her digestion. So, she has somewhat of a sugar propensity, but, I think that tinned or canned goods, they're probably, I don't know if it's exactly the sugar content, but they're not very enzymatically rich, let's say. But I don't know, like for most people, that should not be enough to create a huge problem. Plus, she's had it before. So I would there is a possibility. It's always with any skin problems, you want to see what the ventilation is through both the lungs and the intestines. How well is this person getting rid of toxicity through the bowels and through the lungs? Possibly in the through the kidneys as well. So those would be the things that I would look at as options.
Okay, that's good, Avi. Yeah, there's a lot in that. Yeah, and I'm hoping to have her home maybe in 2 or 3 weeks' time if she is able to get home. So I'd be able to look at it a little bit more with her again.
Yeah.
So that's the aim. So that's what I'm hoping, that I get a few more treatments in with her. Okay, that's very good, Avi. Yeah, thanks very much.
Welcome.
Can I make a side comment, please?
Yes, of course.
The Mirena coil is synthetic progesterone, and that's highly carcinogenic. I would not recommend it.
No, I mean, I don't want her on it either.
Yeah, okay. So you're aware.
Okay.
Yeah. You're aware, as long as you know. Okay. I understand you know. Yeah, she's 27.
It's a little
I
hard to tell
understand.
someone else what
Yeah,
contraception to use, but yeah, it's a. I mean,
Very,
I generally suggest to my patients, don't, the best, unless they're using something, and it's usually the pill, um, for really to control painful periods, and that's the only thing that's helped, because at that point there's going to be a huge resistance. I generally suggest to women to get off any contraception, except and use condom. You know, it's one can argue whether condoms are, they'll say, oh, the latex can do this, that, and the other, but I
yeah,
think it's the safe. Well, it may. I don't know how safe it is in terms of contraception compared to the pill. It's supposed to be relatively close. It's problematic, obviously, because it requires a second person to cooperate. And those persons often don't, unfortunately, but that's exactly why I think it's the best method, because it's the most feminist method. Let the men
yeah.
take care of it, damn it.
I,
But
I didn't I didn't want to take the conversation off in that direction.
no, I think
I just wanted to, yeah.
it's an
yeah,
appropriate direction, in my opinion, at least. I also think that, and I think that because so many women at some stage in their lives will come and they'll say, you'll treat them, and the treatment isn't moving very well. Like, it's doing a little bit, but it's not really taking root. And then one of the things that I start looking at is, where did you take contraceptives? It could have been many years ago. It doesn't matter, because sometimes you find that, oh, by the way, there's been a contraceptive issue, and that's just screwed up their hormonal system or the pituitary or something, and it's just, and then you do small intestine 3, UB2, UB66, small intestine 13, and suddenly the same treatment you did before starts to blossom. It actually takes root. So there really is the issue, and the problem with contraceptions is that, hormonal contraceptions, is that you can't always tell. Some women, it's very obvious. They take the pill and they're throwing up. Some women, it's not going to be obvious. It's not going to be clear at all, and possibly for many years later. So, and any change can create some problems. So it's true, you're saying she started using the coil 6 or 8 months prior to the appearance of the acne boils.
mm,
It might have taken the body that long to to accumulate or rebel, or whatever it is that's happening there. So it's always a suggestion, and like in this case, you're a mother, but you're also the practitioner. As a practitioner, all you can do is suggest. I mean, what else can you do? You can say, by the way, there's a possibility this is affecting you. Up to you what you do with the information.
sure, sure.
And I just always, when I ask on my form if they're on any contraceptions, and I usually go through this whole damn lecture of how I don't like with the pill or whatever, and which is not very helpful, is it? And I leave it to, and so some women who are just like totally, it's like you gave them permission to undo it.
Mm,
And some women, it just creates like, yeah, fine, whatever. I'll do it. It's a little bit like the discussion that some practitioners, I don't have that one, but a lot of practitioners have discussions about coffee. It's like, I don't think you should drink any coffee, or you should only drink 1 cup of coffee, whatever. It's a difficult discussion. It's like, you can have an opinion and accept that that's your opinion, and the other person will have another opinion, and that's just an opinion also. And there are obviously some very healthy people who are drinking tons of coffee, and also some very sick people who are drinking a teeny bit of coffee and get very sick. So it's just an opinion. What can you do? It will fit some people, it won't fit others. So I think it's a worthwhile
yeah.
thing to contemplate and mention, and let her figure it out.
Yeah, I know we've had the discussion before, and I can't even remember what conclusion either of us came to on it. Which doesn't say much, because it obviously it didn't go wherever. So I must have it again. I'm a believer myself in the barrier methods for sure, because I would have been very, anti any kind of hormonal treatments. And she would be as well. She absolutely doesn't medicate in any other way, shape, or form. Unless absolutely, in a serious situation. So, but I must really bring her around to it again, and see
what happens.
There with it, yeah.
All right.
Something to work on, Abby. So that's good. I mean, that's that's a bit more specific than where I was coming from with it, actually. So yeah, so let's maybe go from there and see. But that's definitely very helpful, yeah, for sure.
All right, wonderful.
Thanks, thank you, Abby.
Anything else? Number 2 on the list of 15. That's one of 15.
No, my brains are also gone into decline now. I can't think of anything. I'm struggling with my Japanese approach, as you can imagine. So I'm still working through TCM, but I'm a TCM person wanting to change. So I'm hoping that COVID will encourage me to go from one to the other with a bit more ease.
Well, it might, or it might actually do the opposite, because what happens is, as you know, in this, well, I don't know how it is in Ireland, here in the US, where I'm in a place where there is no second surge, but there is a second surge everywhere, almost everywhere in the US, except the Northeast. And so I'm definitely much more inclined to spend the least amount of time possible with people. Do you really want to stay in the room and breathe this thing, even if you're with mask and touching, and so it may actually create a situation where you're going to want to do more work theoretically for a while until the world feels a little safer. So I wouldn't rush it. Because for most people at the beginning to do this style, I mean, there are many Japanese styles, obviously, but this style where it's very, very palpatory oriented, for most people it takes a while. First it takes a few months to a year before you feel comfortable, but it takes longer with a patient. Because you're palpating and you're going, I wonder what this means, and it just creates more questions for you at the beginning, and you need to spend a little extra time. So this may or may not be. It's totally up to you and how you feel, but don't be disappointed if it turns out that it's not the best time to convert to a system that's more manual and therefore requires more time of you at this point. There are people who can do this style in 5 minutes, tops. They're done needling in 5 minutes. It's amazing. But not everyone's like that, and especially the so-called beginner tends to require more time. So do what you're comfortable with. But given that it's your daughter, we're talking about, she's going to stay at your house, presumably. I mean, all the considerations are very different at that point. So you can afford to. It's not the same as treating a patient.
Yeah, of course.
I would go for it.
Correct, yeah. Oh yeah, for sure. I'll definitely start with her and go from there. Another willing victim.
We need guinea pigs.
We do.
All right. Anything else?
I don't really. Have you, Mary Jo?
I was just wondering, have you ever treated oral thrush?
Oral thrush, yes. So again, you do need to treat the immune system and the digestive system. And again, because it's oral thrush, the spleen 3, liver 3 is the so-called dogma for that. Because it's a mouth thing. So it comes out of a weakness. I mean, so the theory would be, in TCM, the thrush will be dampness. You would still say, like if you want the theory of it, a theoretical framework, it's still, yes, there's a weakness in the digestion, the weakness in the immune system that allows this fire to accumulate in the tongue, even though in TCM it would be considered more dampness than fire. Okay, and a lot of these people are, a lot of thrush is very much, a lot of these people are cold. you know, but there's definitely an immune component in it. Now, I may be somewhat more inclined towards this point of view because most of my thrush experience is from the AIDS epidemic, you know, so and that was an extremely common symptom, and it was obviously an immune deficiency. But and a lot of these people, while they were cold, one of the common, you know, again, I'm not a TCM person, but one of the common things that you saw in the HIV/AIDS world was urine deficiency fire. So even though the symptom itself suggests dampness, there is, you know, and even though it comes from a cold, you know, like a deficiency or a cold organic situation, there is still a fire component, even though the thrush doesn't have to be yellow for you to say it's heat. In my opinion, you know, in the way I'm treating it, it's still a liver fire. Does that make sense?
Yes, yes.
Of
Even
course
though this person is actually quite warm, you know, and never feels cold much.
Then okay, so they can have fire without cold underneath it. That's fair enough. Yeah, but generally it's definitely a weak immune system, so definitely immune points, possibly, you know, to that you can add, say, kidney 6 is another kind of immune point, so I would look into that and then look at their digestion.
Yeah.
And we have someone else. Tamra, are you with us, or is someone else on the line? That's why I'm just checking.
Yes, I joined this morning. Yes.
Hi.
Hi.
How are you?
I'm well, thank you.
Good. So feel free to join anytime. That's why I asked you to unmute, so you can monitor your own input in your own way.
Thank you. I'm not yet licensed in the United States.
No problem.
I'm a student going through board exam process right now, and just wanted to learn more about Japanese style since I've not had a great deal of that in school.
Oh, okay. Well, you're welcome. Which school did you go to?
Pima.
Sorry? Which one?
It's called Phoenix Institute.
Oh, it's in Phoenix. All right. And you're waiting to take your boards, the national, or does Arizona have its own exam?
The national exam.
Got you. Oh, and are they giving it right now, or is this a big delay?
There was a 2 to 3 month delay. Now they've reopened
Okay.
on a limited basis.
Okay, well, good luck with it.
Thank you.
So unfortunately, yeah, I don't know. Well, you know, if you want to see more of the style on my website, acupuncturemedical.org, there's a professional corner and there's tons of videos of classes and treatments. And you can, I don't know if you necessarily want to do it while you're kind of memorizing Machiocha and Deadman and all that kind of stuff. It might be a little confusing, but if you want it, and it's all free and there's lots and lots and lots of it, so feel free to browse.
Thank you, Avi.
That's helpful.
I have been on there and seen some in the past because it was intriguing me. And I remember you being with a patient demonstrating something for one of your groups classes and seeing you point out that you touch one point, and then if you get more reaction in another point, then that's the point that you do because you'll treat the other point. I'm not saying this very clearly, but you might have.
All right.
You
So
found
yeah.
one point, then you found another point that took away the sensation at the previous point, and that was your go-to point because then you could also treat that other point.
Yeah, I mean, the idea is that you're diagnosing by palpation. Well, you partially diagnosing by palpation. I don't want to because you're actually diagnosing from the medical history, etc. But you're finding certain areas, say in the abdomen or the neck or the back, that are uncomfortable. And then you're, according to your theoretical diagnosis, you're pressing on points that you think should resolve it. If the point actually releases the pressure pain on, say, the abdomen, the neck, or the back, it suggests, it's not a guarantee, but it suggests that the point is useful and that it has an effect. Many other people in the Japanese styles do it purely by pulse. They take the pulse, they press on a point, and they say, oh, the pulse changed. It's much smoother, it's much stronger, it's much whatever. To be able to do that is a little bit a higher trick, so to speak. Palpation, everybody can, you don't have to have special hands. You press on the abdomen, the patient tells you, oh, this is painful, and then they say, oh, wow, it's not painful anymore. So the pulse, you have to have a lot more training to be able to discern changes in the pulse, and to have the confidence that when you press on, say, spleen 6, the pulse really changed. Because the pulse changes all the time. So then you're sitting there going, did the pulse change because I pressed spleen 6, or did the pulse change because it changed? So it requires a much more refined capacity as a practitioner. So, which is why I like the abdominal palpation a little bit more, but primarily the palpation is more for confirmation, even though it's diagnostic to some extent, but it's primarily for confirmation of point. And I'm really using the best, well, what appears to be the best point for this person.
I won't take up the time here, but I do remember you had a point that was underneath, like gallbladder 44, basically. It was on the underside of the fourth toe.
Uh-huh. Under the third toe? Okay. Under the third toe, so like, this is my fingers obviously, but this is for blood pressure versus both low or high or weird blood pressure, as well as what we call sympathetic dominance, meaning people have nervous system disorders, usually with more of a rapid pulse. So it's a tight nervous system that doesn't adjust well, which is why the blood pressure, because the blood pressure should reflect a good tone of both the parasympathetic for the diastolic and the sympathetic nervous system for the systolic. So some people will not have high blood pressure. For example, they'll have 100/60 or 100/70 is a better example. The gap is too low. The 100 is not considered low pressure. The 70 is certainly not low blood pressure, but the gap is not very good. Or if I can even narrow it a little further, let's say 100/75. That's definitely a weird number. The same thing if you say somebody has 120/60. Neither number is abnormal, but it suggests the body's not is not capable of adjusting easily. And then, of course, you have the high blood pressure, and then you have the low blood pressure is a much more serious issue, in my opinion, than is given credit to. Most people go to the doctor goes, oh, you've got great blood pressure because it's low. Like it's being done to me often. And it's actually a problem because too many of our systems require a certain amount of blood pressure. Your digestive system, your gynecological systems, the exchange of air in the lungs, everything requires blood pressure. It's not like you can say, oh, low blood pressure and you don't have, you're not getting dizziness or fainting, everything is good. And often a very typical issue is people will have both, they come often with digestive issues and mental emotional issues. Very, depression, anxiety, things like that. Very common for low blood pressure person. And that's an essential treatment for them.
Excellent, thank you.
You're welcome.
If you have time, I'll just posit 2 more questions and you can get to them as you have time.
Yes.
This current circumstances coming out as a practitioner in this time frame of history, I would like to know your thoughts, and I do have a couple of books at hand to read from Pico and Stephen Birch. But what would you say in terms of both building immunity for those that are lucky and able to isolate and not encountering the virus at this point in time? And also, what would you say on the other side of this when we're dealing with the post-pandemic period? How would you suggest practitioners have a mindset, and what would you expect them to see and have to deal with in general terms? And I know you can just have lots of comments, so choose whatever.
It sounds like were you a journalist in your previous life?
Yes, I was.
Okay, you can hear it. So, they're both really extensive situations, and it keeps developing. So there's tons of protocols that one can do. So let me just talk in terms of, as a practitioner, what I personally do. And I must say that I've been a little bit relaxed because I'm in New Hampshire, but you're in Arizona. So you're really you're like in the heat of things right now, so it's very relevant. Moxa on the immune points, so between large intestine 10 and 11, but on the edge of the bone, you'll find a sore spot. Direct moxa on it daily. I did moxa on stomach 36, even though that's not my favorite point in any way, shape, or form, just because everybody said moxa on stomach 36, and I did it for like a month. So, and rinsing the nose. Salt water with thyme essential oil, oregano essential oil, rosemary, and essential oils are very antimicrobial. On a daily basis, rinse your nose. Then eliminate sugar from your diet. Eat well as much as you can, given that you may not be wanting to go shopping very often. So maybe you're not eating the freshest food in the world. But you do what you can with it. A certain amount of exercise and breathing exercise. You see, I think the problem is we're no longer thinking of COVID as necessarily a respiratory virus, even though it's airborne, or we think it is. We keep developing our understanding. So this is very odd. But, just do everything you can, as long as you're healthy, and as long as when you're not healthy too. There's actually a section on my website and it is old. It was written in March, for advice for patients on how to take care of their immunity. In terms of where this profession is going next, none of us know. It's going to be, some of us, including some of us who are sitting on this call, are kind of thinking this for a few years is not going to be a very nice profession to be in, and it's going to be very difficult. Some of us might be much better equipped to deal with it with telemedicine and prescribing herbs. I'm primarily an acupuncturist, so telemedicine really doesn't work well for me.
Yeah.
I will say that treating people has been not much of a joy. When I don't treat a lot right now, and the ones, when I do, it's always like I don't feel I can do a good job because I just feel like I'm not, like I don't want to spend too much time in the room with them in spite of being with Matt. It's just problematic. It's just not. So I think it's time will tell. I think that of course, there is this whole movement of, Chinese medicine is so good at counteracting viruses. We're not 100% sure. There were some reports from China at the very beginning on that, and but the disease is no longer Chinese. The disease is everywhere else. There's certainly acupuncturists who are getting decent results with, given what their access is. But I think it's going to be very different environment for us to work with. For example, I ask people, we talk on Zoom, and then they come in and they're supposed to just get on the table and we just do the acupuncture, but since I require feedback, it's never quite like that. I think it's definitely going to change our perception of how we work. But then, if there is if there's some sort of miraculous vaccine or the disease, look, every epidemic miraculously goes away eventually. It's just a question of time. And just like none of us are affected by the 1918 epidemic or any other epidemic, I can say as someone who's worked with HIV/AIDS in San Francisco in the early 90s, it doesn't affect my consciousness so much. Over time it goes away, and we're all going to want to go back to normal, or the normal that we remember. And if we're given the chance to do that, and if we're given the chance relatively early, COVID may not be as big an effect on how we operate. I just don't know. It will have a strong effect in terms of, since most of us are working on people who are paying out of pocket, I mean, the economy affects us. And if the economy is going to be such that people are going to be hesitant about seeking medical care that's not covered by acupuncture, that will affect us. But that's not necessarily a technical effect. So I think it's too early, like all these discussions about, COVID, everybody wants to have, I have the right answer. Let's remember, this is a 6-month-old disease, a little bit more now. In 20 years, we'll know something about it. What a quote. Does that mean, so I think it's just, I think it could have a huge impact on the profession. And it could, in 20 years, we'll look at it and say it had, bullshit, did nothing. It was meaningless. We just don't know yet. And I don't know what it is. And Camille has a comment. Go. I saw you on mute.
Thank you.
I know you did, because you said that the moment. Yeah, I keep myself muted, but so I do have a comment, but I don't want to interrupt.
No, please.
What you're saying. Well, I think one of the things that's important, that I would want to know if I was just starting out is I think that there's going to be a tremendous market among quote unquote recovered people who have symptoms possibly for the rest of their lives, because I think that that's very true. The new data is really saying that this has a lot in common with the herpes family of viruses, something like shingles or actual herpes, where every time the body is under stress, it comes back again. I've been seeing it with some of the patients I've been treating with telemedicine, or rather, I should say, I've fewer patients that I'm treating directly, but some of my students come to me and they've had cases. And what we're seeing is even young people in their 30s, where they seem to have recovered and everything's fine, and then they go through a stress, and then they come down with a full-blown case of it where the chills come on and everything's like day one again. So I think that the more that you can know about secondary symptoms, about things like kidney disease, liver disease, the more you can study, blood stagnation and the implications of that, the more you can look at the lungs and the herbs to protect the lungs. I think all of that, you're going to have a full lifetime of practice treating the people in Arizona who are getting sick and are going to have to live with the sequela for the rest of their lives.
Yeah, I think that's fair. That's definitely a big option. Yeah.
You could have a full practice in that. You could be the go-to person in the greater Phoenix area and have more patients than you'll have time for. So don't feel discouraged is what I'm saying, that COVID is sort of taken away your dreams and your intention. I think the need for our kind of medical care is going to be tremendous, because Western medicine doesn't have a modality to do chronic care. They just don't. And the system is going to be very, very broken in the next few years. So I think I think that there are profound opportunities if you find the right niche for yourself.
Thank you, Camille. Appreciate that.
Thank you.
All right. Anyone else? By the way, Tamara, was there a second question, or were those two were the two questions, or was that one question with two? Because you said you had two things.
I combined them just to give you an option.
That's what I thought. All right. Anyone else?
I think so. I don't have anything else. It's certainly food for thought, though, isn't it? The whole post life after.
Sorry, I did.
I
And you,
suppose, it just brings to mind, where do you make calculated risks relative to anything we do from here? Because everything really we do post-COVID, well, certainly even as practitioners, everything is going to be made as a calculated risk really. Whether the practitioner is willing to take a calculated risk and have their clinic set up ready to go as safe as possible, and whether the client is willing to take a calculated risk to come in.
yeah.
I mean, it's a very mixed picture. And what one person will perceive as being absolutely more than enough care being taken, somebody else might think that's not enough at all.
Yeah, it's true. I think we can't really tell where, so yeah, Camille is giving one option, which is, regardless of how things will look, I mean, at some point, presumably, we will all get adjusted to this, and people are not going to be scared of being in the same room with another person. I mean, because yeah, right now, I'm personally not getting patients calling on the phone. I don't see that. So I'm like officially open. I'm officially open, but I'm basically not open. Now, I could go and push it, and try and get people to come, like people send emails and, oh, we're open, da, 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 da. But my view is I want the patient to come off the totally with no, because it's really important for me that the patient really, the way I see it right now, I'm only treating people who are like really, really, quote unquote, desperate for this. But at some point that will change. And at some point, the situation that Camille's talking about is, that there'll be many people with residual COVID issues, things that had started, like say, like things that, like the death babies or whatever. There's things in medical history that leave traces 40, 50 years later. Okay. So what will happen is that, and at the same time, the issue of actually contracting COVID is not going to be a big deal anymore. Okay. At that point, that'll be one world. When we get to that world and how long it will take for people to feel comfortable is no one really knows, because part of it is it's our psyche we're talking about, and not just the so-called, what they like to call the scientific evidence. Because much of this, like we may have a scientific evidence that says, okay, the transmission route is no longer, we've just declared that it's no longer by air, it's really, through, it's that spinach you were eating or whatever. People are still, in our minds, there's still going to be a lingering effect. Some people will shake it off immediately, and some people won't. Because we're all different in how we take. So yeah, I think that what are you as a practitioner have to decide what you're willing to do, what's important for you, and for some people what's important, it's like, I'm just not open, period, done. And for some people it's like, oh, I'm going and treating everyone. And the same for patients. Some patients, it's like, yeah, my shoulder's hurting, but I'm not going anywhere with it. I just don't want to deal with it. And also to remember that the amount of cleaning that you're doing, you're spending almost the same amount of time cleaning as you are treating. So that's a whole other kind of like, oh boy, that's part of the non-fun part of it, is that it does require a huge amount of commitment to maintaining a clinical space with a whole bunch of rules that are not necessarily terribly comfortable or nice. And is that something you want to work with? And what are your options? That's the other thing, is like, like some people, it's just like, not every bus driver can say, I'm not driving a bus. But if you're 64 and a half and about to retire in 2 months, you can say, screw this, I'm retiring, I don't want to drive the bus. So it all depends on who you are, where you are in your practice, in your life, and your own personal understanding of your life as to what you want to do. And it's this exact same thing that every patient deals with when they decide to call you or not. They're saying, I want to deal with the shoulder pain, but I'm not dealing with this COVID bullshit. Or they may say, no, I want to deal with the shoulder, and a lot of people just go, and I trust that, the clinic is clean and that they're taking precautions. Some people by their nature are trusting authority, and some people by nature don't. So it's impossible to tell, and it's just very, very individual as to how we want to do it. And it's kind of funny that here we are in the U.S. Back where we were in March. We thought that in May we kind of everything got opened, and we thought okay, we must be okay, and here we are. Basically, we didn't close for long enough. Whatever, I don't, it's all very political, obviously, but or it has a political implications. And here we are contemplating the same things that we talked about in March when this all started. So who knows? I mean, we could be back here in 5 years chewing the same COVID.
I'm going to be retired by then. I never survived 5 years of this.
I agree. It's going to be quite, but I think it's from the perspective of stamina or perspective of just acceptance or whatever we call it, it's worth just contemplating the possibility, and what does that mean? I'm not saying it will be like that. I'm not saying we should, I don't, it's just to contemplate and allow that to permeate one's consciousness is worthwhile, although it is depressing. I totally agree. So.
Well, and may I also comment?
Yes.
One thing that's important to look at, Tamara, is your business model, because, when I started out, I would see 3 to 5 patients at a time. And those days are really over. You can't go from room to room to room to room anymore. So the kind of clinic setup that you're going to have, probably 1 treatment room, maybe 2, if for some reason, you want to have a second one that you can start in while you clean the other, or have the other cleaned. There are a lot of business considerations that didn't exist, a year ago. And if you want to discuss that, Avi and I have been around for a while. I think we could share some thoughts with you on that as well, if you'd like, when the time comes after your boards.
I will say though, Camille, I think that the right. I mean, first of all, there are people right now working with 2 or 3 rooms still. There are definitely people managing it. It all depends on whether sometimes people may have assistants that clean for them, etc. But also, I think that this is temporary, or conceivably temporary. I think in a year or 2, there will be people working five rooms at a time.
Oh, well, that I'm not talking about a year or 2 from now, and and maybe Tamara won't even be licensed for however many months. I don't know exactly where you are with it, but it's just a consideration. I think maybe some of those people who are still treating in 3 or 4 rooms are partially doing it because that's the clinic they have, and that's maybe they have a lease on that clinic. But if I were starting out brand new, I would want to really consider what my practice looked like and make that part of my business model. Because, for example, as you know, I gave up my clinic. Fortunately, I could, because of the nature of my lease, because I knew I would never treat that many people at one time again when I do go back.
Gotcha.
Yeah. It'll be a much smaller place.
I mean, part of the thing about being I will say about being a first-year practitioner, or not even a first year, but even longer. In my experience, and the experience of seeing other people go through it, it's possibly a very nice time and very exciting time, etc. It does happen to a few people, but for a vast majority of people, the time once you pass your boards until possibly 2 or 3 years later even is one of the worst times of your life. And the reason why, in my opinion, this is it's an opinion. I'm not enforcing that. I'm not saying you should go through that. But what happens is you go through school, you know, everything that's expected of you, you go through your boards, everything is being told, you've been told what to do. Now suddenly you're out in the world and you're working for yourself, which is hard for most people. Some people it's very easy for. But most people, it's suddenly and suddenly, you know, like before I had to study, do my exams, do whatever I need to do. I knew what was expected. Now suddenly I'm totally dependent on all sorts of, you know, of people calling me, and suddenly no one is calling. Like I'm suddenly worthless because it takes a while for most people to establish a clinic. Some people are exceptions. There's always one or two in each year that immediately open a clinic, and tons of people just come by, and you know, it's always amazing like that. But most people it takes a while, and a lot of people are, you know, being underemployed is not a very nice feeling. And that's what happens to most people in the first few years of practice, sometimes for longer. So just to be prepared for that, which is sometimes might be something to consider. Do you want a clinic? At this point, we haven't talked to you, but really about what you want. But sometimes you have to ask yourself, do I want to right away go and start my own clinic and look at space, or do I want to like try and do something safe in terms of, you know, maybe I can rent some space at a chiropractor to get some referrals. It may pay very little or whatever. I mean, there's some other options possibly, and then you're kind of getting the benefit of not having to do all of the, say, cleaning on your own. All the, you know, there's a lot of procedures that come with a clinic, and a lot of these procedures, as someone who's starting out, they can be like, oh my God, you know, I mean, it's hard enough on a regular basis without COVID. So on top of it, to have COVID on top of it may not be, you know, and for some people, that's exactly what they want. That's exactly the kind of challenge they're looking for. So I think it's going to very much depend on what you want, your level, your comfort levels, and with challenges or safety or whatever, and figure out what you know, and maybe just figure out something for the next year, for the first year, because things will change. They'll change by virtue of you're no longer a first-year practitioner. You have more confidence, you know more people, you have some more referrals, blah blah blah. And also because this is the first year, you know, of the COVID hell, and that should hopefully pass. So is it, you know, what kind of decisions do you want to make, and do you want to make them very short term, or do you want to look at long term? I mean, it's very hard to know, and it's a very personality oriented, I think. I mean, I have to say, I don't know what I would have done if I were coming out of school right now. Um, I mean, I don't know what I would have done if there was no COVID coming out of school, because I came out of school 30 years ago. It was a very different world, in terms of for acupuncturists in general. So I don't know, you know, my information, my non-business model is very old. It may not be relevant anymore. So unfortunately, I personally don't have a lot of advice to offer. Anyway.
One point of encouragement as an aside is that I did read an article yesterday, which was the most encouraging thing that I have seen, in terms of our government taking it seriously, which is that the Republicans are finally getting tired. You know, they're finally recognizing that it's a problem. So the Republican governors are talking about it. Mitch McConnell is making comments that he disagrees with Trump, which he has never done in this whole period of time. So I personally found that to be encouraging, is that at least the people who have been obstructing things are finally waking up. So maybe we might by the time you finish the boards, Tamara, and are actually licensed and ready to start, maybe we'll have pulled our heads out of the sand. So,
And whatever you do, Tamara, do not treat the R COVID. The Republican COVID should not be reversed. Now that they got it, you do not want to treat it. You want to keep them cooperating.
Thank you very much.
So I don't know if that was helpful at all, or just annoying or confusing or whatever. So
Hey, we're all in this together. Thank you so much for
we
your
are.
excellent advice.
We are. Anyone else before we end?
No, nothing beside of you, I think.
No, nothing really, Abby. As you say, it's a different world, so we all have to readjust and start again.
Fair enough. All right. Well, have a wonderful week and enjoy. And we'll be here next week. If anybody
thank you
comes,
so much, Avi.
you're most
Thanks,
welcome.
Abby.
Abby.
Thank
Thanks,
you.
Rosie. Bye. See you. Take
Bye.
care.
Bye. Bye.